Awesome. We're good to go, Pauline.
Okay, thank you so much.
No
Thanks
problem.
for your patience, everyone. So I've given the brief introduction to myself, and why this topic is of such importance to me. As I mentioned, I am a practitioner at this point, in addition to using these techniques to get through my own challenges, in health-related stress and anxiety. So as a practitioner, I do have to make the standard disclaimer that this presentation is for general educational purposes, so it doesn't replace, personalized assessment or guidance by a healthcare practitioner. So just, I'm sure you all understand that, but just so you know, not everything works for everyone. And even with, simple self-care techniques around stress and anxiety, some things don't work for everyone. Okay, so if you find that a certain technique, even tonight, doesn't work for you, you are very welcome to not do it. And this is an important part of what we call like trauma-informed care. So you have choice, your body is yours. These are suggestions and invitations to try out. I will also say that in my own journey, what I developed over the years is basically a toolkit. And that's what I'm hoping that this can contribute to for you. So basically having a bunch of tools in your toolbox that you can pull out and practice from time to time with little stressors and bigger stressors. And then you get to know which practices, exercises, techniques, or tools are helpful to you and which, are don't really do much for you. And then you can, and the more you're familiar with them, you can pull them out at the time you need. So we're going to practice a little bit tonight, and then I encourage you to actually continue to practice, but again on little stressors. Even if you just practice something every day, then you're more used to using it when you're in a situation of higher stress. Like, let's say, something has some sort of news has happened around the diagnosis or whatever, then there may be a heightened moment, but you're used to using your tools that can help you. Okay, so let's just do a few opening exercises. So this is about getting into the body. That's what I was hoping that this presentation would be, a little bit more interactive. So for these opening exercises, some of these draw from somatic. So what we're going to do, again, these are invitations. So the invitation is to actually turn your head, to the left, to the right, and look at your surroundings in your own room, in your own home. Look, note where the walls are, note where the floor is, and note especially the windows and the doors. So just take a little look and just remind yourself, I'm safe. I can leave. And even in this Zoom room, maybe you note the leave button. You can leave this Zoom at any time. And this is a lesson from somatics that to generate a feeling of safety, we have to know that we're here by choice. We do have a choice. So that's the other thing about looking left and right, and this will come up throughout the session, is that by doing something bilaterally in our body, that also helps to balance the nervous system. You can almost think of it as like left brain, right brain. We're kind of balancing things. You've probably heard of something like EMDR, maybe. Um, so that's eye movement desensitization. There's actually traditionally in Chinese medicine, we have eye exercises in Qigong, which involves stretching the eye left, right, up, down. Because sometimes in stress, we get very sort of our body gets used to being in one particular held way. And we're not used to kind of balancing things out, and that can help to loosen up the situation we're in. Um, Okay, another couple of introductory things. So let's just make a few sounds. I know most of you are on mute. Maybe I should mute myself too for this part. But basically, sometimes when we look left and right as we're breathing, we may find that, there's the urge to uh, sigh, like just let go of a little bit of tension in the body. And you can make those sounds, you can stretch, you can, like just let yourself vocalize Just let it out. Again, a lot of times we're just tight, we're holding things in, and this is just, again, to warm up, to get into the body. So you can stretch up, you can stretch out, you can, roll the neck a little, whatever feels right to you. Okay. We're just doing these briefly, just to kind of get warmed up. Okay, the next one is very fun. It's sort of like left and right because it's balancing, but it involves something soft. This is from somatics too. So I don't have any stuffed animals. I use a soft fleece sweater. But you can use anything soft, just like a sweater, a cushion, a pillow, a blanket, doesn't matter, a towel, something that's kind of sensory soothing. So again, sometimes with anxiety, with stress, there's the need to kind of soothe. Sometimes there's a bit of like the so-called child self is coming to the forefront, feeling scared, and the soothing can be very helpful. So we're doing a little sensory soothing now. We're just getting something soft and we're just squeezing it in one hand. And we're squeezing it in the other hand. We're just alternating back and forth from one side of the body to the other side of the body. Just doing a little squeezing. Yeah, I know we're not all in one room, so I wasn't able to provide you all with stuffed animals. But again, these are just some ideas, some warm-ups, okay? Okay, just a couple more here with the warming up, pulling on the ears. So a lot of times there's tension in the jaw, in the neck, in the face, and we can just pull on our ears up, out, down, and that often helps with the tension that we feel around here. Plus, the ear in Chinese medicine it represents the whole body. So actually, as we're massaging the ear, we're actually helping with the circulation throughout the whole body. So you may have heard of, ear acupuncture and that sort of thing that can treat so many things just on the ear. So massaging our own ears is another thing we can do to just help relax. And then finally, we can scrunch and relax the face. Just part of our warm up. So we can just do a little scrunch in whatever way. Tighten up the jaw, the lips, and then relax and tighten and relax. And that's something we could do throughout the whole body, like tighten and relax all throughout the body. That's another technique. Just wanted to kind of, you know, give you a little taste. If you want to share anything about how that made you feel free to drop it into the chat. I'd like to get moving because I know we started a bit late today. So, I mentioned this will be mostly practical, but I just wanted to give a little bit of theoretical information. So what we're doing today is we're talking about increasing our resilience really to stress and anxiety. And what that means, you can think of it as on the left side, this is called the window of tolerance, which some people call the window of capacity. So this is kind of the amount of stimulation that I can tolerate or that I have the capacity to deal with and still feel, balanced, grounded, positive, happy. Um, but if my window is very narrow, then if anything happens slightly outside my window, something a little bit too jarring or something a little disappointing, quiet, then I might easily get out of balance. So I have a limited capacity to handle stress, changes, unexpected news, etc. Whereas what we're trying to do is get our toolkit so that as we practice it, as we understand our body and mind better, we will be more able to tolerate wider amounts of stimulation and stress. So our resourcefulness and our resilience will increase. You don't need to memorize this or anything, but this is a more complicated from somatics way of looking at it. But I just wanted, the only reason I included this slide is to show you, yes, in a regular, there's a stressful thing that happens. We might get a little activated, but then we settle down. We might get a little activated and then we settle down. But see, this is still within our window of tolerance, these two lines. And we know we're outside of the window of tolerance when these other things happen. We might get very sensitive. We might have a lot of intrusive thoughts, anxiety, panic, fear, reenacting things in our mind. Or on the other side, when we're kind of hypo, we're numb, we're shut down, no energy, a feeling of despair, hopelessness, shame, or defeat. So when we're in the middle, we're much more balanced, but we can notice these types of words can show us, okay, we're a little outside of our window, you know? We don't have to live like that. Let's try to do something that gets us back in our window. And the other thing about this is that you can notice when you're getting close to the edge. So as you get to know, as I've gotten to know, for example, where my window starts and ends, then I can notice when I'm starting to get, am I starting to get a few more thoughts happening, and then use some of these tools to bring myself back in. So this is kind of the overall framework of what we're trying to do. Get tools to widen that window and to bring ourselves back into that state of more relative balance. Okay, let's see. Can you move from off to on? Can you move from off to on? So Amy asked, oh, I'm glad that was relaxing, Barbara. Okay, can you move from off to on? I don't totally understand what that means, Amy. So maybe if you don't mind clarifying, that could be helpful. AJ Pal, if you don't mind helping me keep an eye on the questions, that would be great, like you did last time. Oh,
No
sometimes
problem.
feeling numb, sometimes. Okay, so Amy, you're talking about kind of bouncing from the bottom to the top, like bouncing from the numb to the panic. You're kind of bouncing like that. Is that what you mean? And the answer is yes. Okay, so yes, that's what you mean. Okay. Yes, so actually it can get quite complex with, so that's actually probably what this red line is about. So see, there was a trigger and this person's kind of bouncing between the hypo and the hyper. You don't have to just be one. And the illustration, and sometimes you can actually be, there's different parts of us. So part of us might be hyper and the other part might be hypo. So yeah, that's all part of understanding our nervous system better. And today is so basic and so brief, so I don't think we'll be able to discuss the ins and outs, even this sidebar about different parts of the nervous system is a little complicated. But I just wanted to give you an idea about the window of capacity or the window of tolerance. Does that make sense? But yes, you can definitely bounce from one to the other, or you can have multiple things going on at once. Okay, so in terms of the toolkit, so there are many aspects of it, and what I did when I was developing my toolkit is I literally had a paper where I wrote at the top things that might help. And then I like started to just build my ideas because when I was, let's say, triggered or in a more heightened state, more anxious, or let's say more numb, then it's hard to think about what I could do, right? Like it's kind of hard to remember those things at that moment. So I literally had a piece of paper where I would be building my own thing, and be able to refer to it, and then get to know again what are the things that I can do when I'm getting close to the edge of my window. So these are just a few ideas, but you may, come up with many more. So in terms of the aspects of resilience, there's of course the mental aspect. So working on our thoughts through like talk therapy is very helpful. Even meditation is sort of a mental training. Grounding is like training our mind to focus on the present moment. Like some of the stuff we did where we're focusing on our ears, our hands, our like what we're touching, that can be grounding. What we're smelling, what we're listening to, That's all in the present moment. That can be kind of a mental exercise that can help us. And also the journaling and the counseling can help when we're looping. Sometimes we're looping in a story. Actually, honestly, most of the time we're looping in our stories about, um, oh, and I'm going to talk about sort of mild stressors. So I'm not going to go into huge traumas about, the childhood, difficulties or whatever. But let's say a small stressor like, um, oh, that person, uh, you know, took the last cookie and I wanted the cookie or whatever, like, and I'm annoyed at them because I bought it. So we might loop and replay the same situation in our minds. But those types of stories can repeat, and that can be the case for obviously bigger stressors, but I don't want to say anything too upsetting to anyone. So I'll use like mild examples. We're going to focus a lot on sort of some mental and then a lot physical today. So, our theory in Chinese medicine is that the mental and the physical, I mean, all of them, mental, physical, spiritual, are very connected. But what a lot of people don't necessarily realize is that mental and physical kind of go back and forth. So, in Chinese medicine, we're going to talk about the different meridians and what we do physically can affect our emotional and mental state, and also how we think can affect our physical state. So it actually kind of goes back and forth. So we'll do a bit more physical stuff. We're not going to be able to like go into nature today or do a lot of art and music, but I just wanted to note that here that that is an important part of a lot of people's toolkit. So you can, look at this. I can send you these slides later, or you can note it down, but that might be an area to explore for yourself as well. And then of course community. So we all are part of a community. We're interdependent, and having leaning on each other is very important, as well as non-humans, our pets, animals in nature, etc. So, in terms of Chinese medicine, as I mentioned, the physical and the emotional really go together. So, this is just a diagram about the five elements, and I divided up some of the practices into the different elements just as a way of kind of structuring it. Um, so, you will actually find in Chinese medicine that some of the symptoms that appear in the body, so these are the same, see these colors? So the liver, gallbladder, meridian is green, and it's associated with more like anger and frustration. So the green meridian on the acupuncture dolls is that meridian. So we'll often find there's like physical symptoms that tend to go along with the different emotional patterns. Again, this is just, we're not going to be able to go into it in great detail, but this is the framework in Chinese medicine for understanding kind of like the mental, emotional with the physical connection. So we'll start with the water element. So that is the kidney and bladder meridian. So we're going to go through all of the five elements and then just do like a little exercise connected to each one. So this meridian is more connected to the sense of fear. So the kidney meridian is actually having to do with like our foundation in life. Um, and you can think of it as like, family, our root chakra. It's basically very foundational to just even survival and existing. So when it's out of balance, there can be a very deep-seated fear. And I think this is common with a lot of the people I work with who have cancer. I think I maybe forgot to mention, but now as a Chinese medicine practitioner, I primarily work with people with cancer. So um, fear is a very common thing that people may feel. And one of my teachers actually said that a cancer diagnosis is, in a sense, a trauma. So many times the symptoms that come after we may find are sort of similar to a type of PTSD. So there was a trauma of the diagnosis, or for some people, there's um, a bit of post-traumatic stress after, going to the hospital a lot, and then they start to have associations with going to the hospital or through medical procedures and that sort of thing. So there can be So that's associated with the kidney meridian. And something we can do for the kidney meridian is Qigong. So I think Wellspring actually has some Qigong programs, right? So I encourage you to check them out. But Qigong is part of traditional Chinese medicine. We can do this exercise now if you'd like. It's just one simple exercise for the kidney portion. And it's really nice to do in the morning, actually. So you'll see that the person's kind of knocking on their low back. So at the risk of you seeing my room and sweatpants, I'll just go like this. And then you can see there's a bit of knocking on the back. So if you're in a chair, that's fine. You can just turn to the side and so that you can reach your back. And then you're kind of just using your hands gently, gently. Your kidneys are there. Okay, so don't wail on your kidneys, please. But we're just gently kind of tap the lower back. And then again, we can make sounds if we want, or we can take some deep breaths. And we're kind of, it's called waking up the kidneys. We're just kind of bringing some attention to this part of the body. And then we can rub our hands to make our hands nice and warm. And then we just hold it against our low back, our warm hands. They might not be warm yet, but when you continue to practice, you can do this over and over. Do some more rubbing and then holding. Then you can really send some nice energy into the kidney meridian because the low back is associated with the kidney meridian as well as the lower abdomen. Has anyone here done Qigong? Has anyone here tried it? Okay, so Faith has. Okay, so when you actually do Qigong, you're kind of breathing into the lower abdomen, right? Like that's kind of the main focus because in the lower abdomen is what we call the dantian, or that's where our energy center is. And that can be very grounding to breathe into you've heard of, probably a lot of you have heard of belly breathing too, yes? So deep belly breathing is part of Qigong, and for a lot of people, just as a separate practice, it can be very grounding to do diaphragmatic or deep belly breathing. That's when we can do it right now. So just take a deep breath and let your lower belly expand. And then breathe out and relax. And some people find it helpful at the end of the exhale to just pull in the belly a little bit, to just push out that little last bit of air. And then inhale again, letting the belly relax and expand. And then as we exhale, feel the belly come in. Maybe give it a little tug to pull the belly in at the bottom. So that's practicing using our lower muscles to breathe, like the diaphragm and below. So the belly, even the back of the low back, you can feel it expand. And this is a very good practice for a lot of people because a lot of us are so stressed that we just breathe very shallowly. We don't realize we're half holding our breath most of the time. And then also we breathe using our accessory breathing muscles. And I'm totally guilty of this. I was told this, many years ago by, I forget, another Chinese medicine practitioner. But we sometimes just breathe actually using our shoulders. And we're like barely moving our rib cage, our diaphragm, and our belly. So by getting all the breath down there, it brings the energy down. It kind of massages our internal organs. And it's very calming to the mind. I think I have it a bit later as well that we can do a bit of box breathing. We'll do that in the metal element because that's associated with the lungs. Okay, so more water element tips. So Qigong, Tai Chi, and deep belly breathing, that's what we're talking about. And then, going back to the community part of our toolkit. So those supportive relationships, and sometimes we don't even, I know for myself, much of my life, I didn't even pay attention to which relationships were actually feeling supportive to me or not, because I just went about my life under obligation, like, oh, okay, like I'm supposed to be close to this person. I'm supposed to be nice to that person. But see, if you're really putting yourself first in this healing journey, it is very instructive to just ask yourself, like, how do I feel after hanging out with this person? Do I feel better? Do I feel more energized? Do I feel more nourished? Do I feel held by this relationship? Do I feel this person's really listening to me or not? And so if you are able to have that choice, then you could try to shift your time and attention toward those relationships that are really supportive to you. As I mentioned before, psychotherapy can help. And especially, we're not going into sort of digging into our deeper, older wounds today, but of course, a lot of times when stress comes up, it's actually triggering some old patterns in us. So the more we can work on that, that's that deep stuff with the water element. So those deep emotional things, if we can, understand them better and bring some awareness and healing to those deeper wounds, then that can help us on a day-to-day level. And then, of course, connection to nature is very helpful as well. Okay. So in terms of the fire element, so this is the heart meridian. And one of the key symptoms of stress and anxiety associated with this meridian is poor sleep. So also palpitations, I didn't say that, but poor sleep, palpitations, and a sort of like agitation, restlessness, being easily startled. These are all kind of an imbalance of the fire element or the heart meridian. Okay, and there's another exercise we can do. I'm sorry, I didn't go into the imbalance. I have a tendency to not focus enough on the positive side. Okay, when this is imbalance, we feel very joyful, loving, the heart is open. There's a warmth, a friendliness, and there's also a clarity because in Chinese medicine, the heart meridian is associated with the Shen or the spirit. So when that's in balance, the spirit just feels very resilient, very calm. Okay, so here's another exercise we can try. This came to me from a healer I worked with for many years. I loved her. She was like a second mother to me. So this is another, remember at the beginning we talked about kind of left-right balancing? So there's a theory in kind of somatic or polyvagal theory where we talk about contralateral movement. So let's say right hand, left foot, left hand, right foot, that kind of thing. So this one sort of does that. So let's give it a try. You're invited to give it a try with me, okay? It's optional. So you can, in a sitting position, cross your left ankle over your right ankle. And then you're going to stretch your arms out in front of you. Let's see if I can show this. With the thumbs pointing down and the back of the hands facing each other. And then we're going to know how the left ankle's over the right ankle. The right hand is going to go over the left hand. So it's kind of backwards. Left ankle over right ankle, right hand over left hand. And then we can just turn our hands inside out. If you can't do this, you can just do it like this or like this. If you can turn inside out, great, and clasp it against your chest. And then we're going to again do a little breathing. So you'll notice that a lot of these exercises involve breathing. All right, so as you place the tongue on the roof of your mouth, then you breathe in and you roll your eyes up. That means you look up to the ceiling as you're breathing in. And then as you breathe out, place the tongue on the floor of the mouth and roll the eyes down. We're going to repeat that 5 times. So up with the tongue on the roof of the mouth. And breathe out with the tongue on the floor of the mouth, looking down. Put the tongue on the roof of the mouth. Look up and breathe in. Tongue on the floor of the mouth. Look down and breathe out. Tongue on the roof of the mouth. Look up and breathe in. Tongue on the floor of the mouth. Look down and breathe out. Tongue on the roof of the mouth, look up and breathe in. Tongue on the floor of the mouth, look down and breathe out. And then, as we unravel our hands and feet, take a deep breath. We actually do the whole thing again, but with now the right ankle over the left ankle and the left hand over the right hand. So remember I said this is experiential? So we're practicing now. Okay, so right ankle over left ankle, left hand over right hand. And then again against the chest, optional. If you're not comfortable with the movements, just breathe or whatever, follow along to the extent that you will. So again, same breathing pattern. We're gonna place the tongue on the roof of the mouth. Look up, breathe in. Place the tongue on the floor of the mouth, look down, and breathe out. Now, when I say look down, I mean with the eyes, not so much with the neck, okay? So, tongue on the roof of the mouth, roll the eyes up, breathe in. Tongue on the floor of the mouth, roll the eyes down and breathe out. Tongue on the roof of the mouth, roll the eyes up and breathe in. Tongue on the floor of the mouth, roll the eyes down and breathe out. Tongue on the roof of the mouth, roll the eyes up, breathe in. Tongue on the floor of the mouth, roll the eyes down and breathe out. Tongue on the roof of the mouth, roll the eyes up and breathe in. Tongue on the floor of the mouth, roll the eyes down and breathe out. All right, now just unravel the hands and fingers. Take a deep breath and maybe just take a moment to just check in with yourself. How do you feel? You know, how's your body feeling? How's your mind feeling? How's your breath? Is it shallow or is it relaxed? Yeah, again, feel free to share in the chat if you'd like, but you also don't have to. Now, we might not get through every single exercise, but we will do our best. So I've got just another couple tips here for the fire element and for sleep in terms of food. And then for the lung meridian, this is more associated with sadness and grief. And we can also find that there's some issues with boundaries. So boundaries are basically, a good definition is boundaries are the distance at which I can love you and me together at the same time. So sometimes we're very affected by other people, and maybe our boundaries are not so clear. So let's say we're doing okay, but then our family member gets very worked up about our health issue or um, the hospital uh, procedures that we're going through, then we may absorb some of their energy. Okay, there's a hand. Yes, AJ Pal.
Yeah, someone in the chat mentioned if you can send the exercise instructions.
Yeah, so like last time, if you'd like the slides, then just email me at the end. So um, I think, yeah, so my last slide will have the email address on it, or I'm sure Wellspring would be happy to give it to you, but you can just use hello@hillgreen.ca. Okay, so there's some self-acupressure exercises as well. Let's just do one of these because of for time constraints. But there are a few other ones obviously that we can do. So I think let's do lung one. So lung one is basically you can see this picture in the lower right here where there's two dots on the upper parts of the chest. So actually the chest is obviously associated with the lung meridian, but also the chest holds a lot of tension. We can even like massage our chest between the ribs and it feels really good. But you'll be wanting to go up in the upper corner of each chest, of each side of the chest, right below the collarbone, about maybe an inch below the collarbone. Sometimes it's tender there. And what we're gonna do, we're not gonna do 3 to 5 minutes, but we'll just do a little bit of massaging with our thumbs again as we do a few deep breaths, okay? So we're gonna deep breath in, and then we can kind of feel the chest muscles almost pressing against our thumbs. And breathe out with the mouth. And breathe in with the nose, out with the mouth. In with the nose, and out with the mouth. Okay, again, just loosen up. Just check in with your body. How did that tool land on you? Did you like it? There's a lot of wonderful acupressure points, but that's the general idea. You just rub it but you have to breathe. If you just rub it and you don't breathe, it's not going to be as effective. So I've got these few here. Um, and there's, other acupressure points I'm happy to share with you. Or if you go on my website, we have a whole I think we have a whole webinar about acupressure points.
That one I
Yep.
on the wrist, that I
Yep.
know for motion sickness, right?
Yes, so
Or for
this one,
nausea,
yeah,
it's
this one is
fabulous, actually.
yes. Oh yeah, it's a great point. That's good for so many things. So it's good for nausea. It's also good for anxiety and sleep.
Oh, really?
Yeah.
Okay.
And when you get those motion sickness bands, so actually,
Yep.
I was just telling a patient earlier today, those bands you can get at the
Yeah.
pharmacy that
I
have a
used them.
little.
I used it all through chemo, actually.
Okay, yeah. So you can put it on that point. So
Hmm.
that's good for nausea, vomiting, but it's also good for anxiety. So for people who are experiencing a lot of anxiety, you can go around, you just go to the pharmacy, get a motion sickness band, and usually there's a diagram of how to get that point. It's just 3 finger widths down from the wrist crease, like the diagram says. You just put the motion sickness band there. There's another point actually similar on the foot. And you can put the
Oh,
motion sickness band around the foot, and this point is just in the middle of the foot. Let's say this is the foot. It's just in the middle of the foot, and it's like 2/3 up from the heel and just behind the toes. There's kind of an indent. So that's the ball of your foot. It's like there. Okay, so you can put the motion sickness band there, and then you can step on it. And that's actually really good too.
okay. So I also found after surgery, when I was getting the waves of nausea, I was just digging into that wrist spot, and it really helped.
Good. I'm glad that helped you. Yeah. Nausea was not the focus of today, but it's a wonderful point. That's good for many
Mhm.
things. So you can
Yeah,
use it for
that's
that
good
as
to know
well. Yeah,
too.
yeah,
Yeah. Okay. Thank you.
no problem. Okay, so I just want to do a little time check because we started a bit late. Are people okay with staying 10 minutes later? I understand that some people may have to leave.
Yes.
AJ Pal, what do you think?
Yeah, it's cool with me. If folks are willing to stay a little bit later, no
Okay,
problem, for sure.
okay. My apologies that we started late due to the technical difficulties. Okay, and then this is just another exercise. I'll keep it in the slides and I'll explain it to you, but we won't necessarily do it right now. So this is more for boundaries because how many of you have found that you might be feeling a certain way, but then once you get around certain people, you start to absorb their kind of like negativity kind of thing? Yeah, I think many of us may have noticed that. So, sometimes it can help to actually use visualization to create a bit of an energetic boundary between us and those people. And we can imagine that we're inside sort of a prism of light and their negativity sort of bouncing off it. We can still see them, we can still send them love, we can still interact with them, but their energy is actually not coming through. Does that make sense? I think in this crowd, that's not going to sound too crazy. Um, but yeah, this visualization is just one of many things we can do to kind of protect our energy. So the metal element is also about having boundaries. If you think about it, like the lung and the skin, that's the boundary between our body and the environment. Because the environment, the air is coming in, it's hitting our lungs, right? Um, so that's why the metal element is associated with boundaries. And then I just have a few more kind of like breathing tips here. So we talked about the belly breathing, and then there's box breathing, which you may have heard of. So that's when you're counting. So you may count, let's say, inhale for 4, hold for 4, exhale for 4. Just due to time constraints, we're not going to try it right this second, but I'll leave it here. And as you can see, there's many variations of breathing. You can try and see which ones you like, which ones are easy to pull out at a moment that you really need it. And the good thing about these activities, most of them, is you can just do them anywhere. You could be at the hospital and you're doing it. You could be in a car and you're doing it. Okay, so wood element. So this is one of my favorite elements because I'm kind of woody myself. So that means I may be frequently irritable. So people who are kind of more wood element, um, the tendency is to be easily frustrated, irritable, maybe get a little angry, and then sometimes it can turn inward and there can be sort of a depression. But for some people, depression is kind of a suppressed anger. And then when we're in balance, actually, we're not suppressing ourselves. The chi is flowing. So the wood element, the liver and gallbladder meridians get all bogged down when our chi, our energy, is blocked. That's in Chinese medicine. Um, so for our chi to flow, actually, we need to be expressive. We need to have areas where we're safe, where we feel comfortable to actually express ourselves. So that could be, again, relationships that are supportive, or it could be creatively too. So doing artistic things, journaling, and things like that can be helpful for this meridian. So that frustration, like I said, it's two ways. So when this element's out of balance, we're easily frustrated, but also if we have sort of a frustrated mentality, then we can put this element out of balance. And oftentimes we're creating a frustrated mentality by, so it's called unfulfilled desires in Chinese medicine. But basically, how I explain it to all the people I work with every day is there's a gap. There's a gap between the reality you wish was here and the current reality. So when you're really focused on that gap, that's creating this dissatisfaction, frustration, or tension, right? And in Chinese medicine, that literally creates a stagnation of the qi. So what we want to do, and it is so challenging to do this, is practice the opposite of that, which is called equanimity. Equanimity is kind of a tricky word, but it's really about being very accepting of the ups and downs of life, of the good and bad, and knowing that, as life goes along, there's good things, there's bad things. That's why it's equanimity. We are calm even when we're calm when things are good, and we're also calm when things are so-called not good. We're not doing so much up and down reactivity. We're just even. The mind is even under stress. So this is really drawing from kind of mindfulness meditation that has its roots in Buddhism. And you don't need to be religious. You don't need to be a religious Buddhist. But I do want to acknowledge that that's actually where the practices of mindfulness meditation come from, is from this philosophy that we can generate more suffering for ourselves if we are very focused or very attached to what we want when that's different from what's happening. Um, so I think what we can do, just briefly, is a bit of an exercise that I've summarized as ABC: awareness, breath and body, and compassion. So you do this when there's a challenge. So ideally practice it regularly, but again, we can practice it on very small challenges. So if you would care to join me, we can just work on it for a few minutes right now. You can just sit comfortably. You don't need to close your eyes, but you're welcome to if you want, if it helps you to focus a little better. Or you could soften your gaze, just look down and kind of don't stare hard, but just have a soft gaze so that you can focus into the body. And then we're going to bring to mind a challenging situation. And again, we're practicing with the small so that we can apply this on the big. So try not to think about the most upsetting situation you're in right now. Just think about a small annoyance, a small thing that, this person cut you off in traffic today, or your partner never does the dishes, or I don't know, but that could be a big thing actually. But anyway, something that's not too upsetting. Just try to think of one incident, maybe from today, or one situation that's a little difficult. And then we'll notice, some of us, as we tune in, some of us will find this easier than others, but try to notice. Then bring the awareness into the body and notice as we think about this annoying situation, this stressful situation, try to notice something about either the body or the breath. So we're not trying to change anything, we're just watching. It's like our body is like a TV show, and we're just sitting there watching it. So we're just feeling, I'm thinking about this stressful situation. Maybe I can feel my shoulders are kind of creeping up toward my ears. Like there's a lot of tension in my shoulders. Sometimes I feel like a little bit of pressure on the chest or the stomach. Or for some people, we may notice the breath has shortened a little bit. It's not its natural, slow, deep baby breathing. It's become a little more shallow, a little tighter. We're just noticing something happening in the body. As we think about this incident, maybe as we imagine ourselves in the incident again. This is one instance where it's okay to replay it because we're replaying it to process it, really. Maybe we're imagining what we said to that person or what they said to us, the expression on their face, or how we were left feeling. And then we just notice something happening in the body. And then the step 3, so that was awareness. And then it was breath and body. And the third step is C, ABC. C is for compassion. So see if we can speak to ourselves kindly. Like, not like, oh, well, why are you reacting that way, Pauline? Just like, oh, you know what? Yeah, that's really hard. You felt hurt by that. And generating some compassion for whatever's happening in the body, or whatever's happening with our breath. And we can even take a hand if we've located a part of our body that's affected. Like, let's say for me, the chest is feeling a little tight. I can take a hand and I can just gently place it on that part of the body with some compassion, with some intention to soothe, with some kindness towards that part of ourself that's feeling difficult. May this part of me experience some ease, some soothing, some gentleness. May I not hold on to this stress. May I have ease and peace. Okay, and when you're ready, you can slowly open your eyes, come back to the room, and again, just kind of check in. How are you feeling? That is actually a very deep practice. We did it so quickly. You may or may not have been able to feel much, but I have worked with people and encouraged them to just practice it. And even practicing anything that gets you into the body, therapeutic touch, qigong, acupuncture, or body scans, yoga nidra that goes through the body, anything that gets you in touch with your body more regularly, this will become easier. And then, soothing ourselves and generating compassion for ourselves and being aware of where the stress is in the body, that becomes easier and easier. So it's just a matter of practicing, but this can be a very deep and powerful practice. All right. Um, and then I think this is the last one. Yes. So the earth element, the final element, is actually the digestive meridians, so the stomach and spleen. When they're out of balance, we overthink. We think, we ruminate, we worry. What about this? What about this? What about this? And we neglect our needs. In balance, there's a certain solidity, strength, stamina, and there's a nurturing of ourselves and our body and mind. The earth element really is about nourishing. If you think about, the earth, it really holds us, it contains the soil, which has so much richness for all of us. And then, so today's just brief exercises we'll do the first one, which is just a self hug. And this this is something that it sounds so simple, but you can actually get more into it with more cozy stuff. So, my fleece sweater, like I can really bundle up in my fleece sweater. We'll just do kind of a very just brief, just wrap our arms around ourselves and give ourselves a big hug. Maybe say something kind about ourselves to ourselves so we can say, you know what, I'm having a tough time, but I'm doing the best I can. Or here's something I appreciate about myself or about how I'm dealing with things right now. There's a few affirmations we can say, or we can just give ourselves some nice soothing touch. These self-kindness practice, you can let go if you want, or you can keep hugging yourself, it's up to you. But these self-kindness practices, there's so many we can do, but really involve kind of dialoguing with ourselves, listening to our body. What do I need right now? Can I even, give it to myself physically? Can I give myself the food, the nourishment that I need? Can I give myself sort of the emotional nourishment I need? Whether that's physical touch, massaging our own bodies, um, rest. Sometimes we need rest. Sometimes we need coziness. Listening to the body as if it's a friend, dialoguing with it. "Oh, what can I do for you right now? What do you need right now?" So that's kind of the earth element. Okay, it was a very speedy little rush through the five elements. I hope you picked up at least one thing that was something you might want to explore more, something you might want to add to your toolkit. I'm happy to stay around for a few minutes for some questions if you'd like. And I'll just check the chat and see if there's any questions. Okay.
Thanks, Pauline. I'll stop the recording here now.
Okay, perfect. Thank you so much.